the United Nations has in its Millennium Declaration and along with its Global Compact looked at business practices and tried to align them with universal practices such as the Universal Human Declaration, which looks at human rights, it looks at environmental law, it looks at labor practices. So I think what we need to do is to work with the government as well as with the United Nations agencies to see how we can make business practices much more aligned to some of the universal principles. Ghana has a very strong economic situation. When you look at the macroeconomic figures, Ghana is very well positioned and it's seen as one of the fastest growing economies in Africa. It's lower middle income by statistics, but it's not a lower middle income society. So we still have a lot of development challenges despite its strong economic growth.
For our first feature, we travel to Pakro in Ghana to visit the Water Treatment and Distribution Center jointly funded by the Coca Cola Africa Foundation and Water Health International. This partnership aims to deliver sustainable and affordable access to safe drinking water to deprived communities in the region.
Pakro has a countryside village. We were fetching water from the stream, Densu River. And then after some time, the government also provided some 2 boreholes. And these were the waters we were using.
And it's one of the reasons why Coca-Cola partnered with Water Health to bring in this facility, because there was also a number of waterborne diseases prevalent in this community, and it's as a result of the contaminated water sources available.
Water Health is a private commercial organization and has provided over 1,000 mini water treatment plants to peri-urban and rural communities around the world. Water is tapped from existing surface water or groundwater sources, and in Pakro is sourced from the Densu River. A community agreement spells out the roles of the different stakeholders. It establishes the district assembly as legal custodian of the facility, whilst the community and its chiefs are the owners, and Water Health the implementer.
This land was donated by the community. In addition to that, in Ghana, there's a community water and sanitation agency. We consult with them and work very closely with them to determine which communities we go into. Also, Water Health formed these water boards, and they jointly with the water boards decide what the usage fee for the water should be. Most people can afford to spend 5 US cents for 20 liters of water. Let's do a comparison. What people normally buy to use, to drink and use in their households is water in plastic pouches. A half a liter of the water in a plastic pouch costs 10 pesos. Half a liter costs 10 pesos, that's 5 US cents. What Safe Water for Africa aims to do is to create private sector partnerships to raise $20 million to provide access to safe, clean drinking water using the Water Health model for 2 million West Africans.
It means saving cost. It means improve health and, for that matter, improve productivity and improve household income, especially in the Pakro area where certain waterborne diseases have been identified. It is women and children, when there's no water, they are the people who suffer most. They spend a lot of their time, especially in the dry season, going out fetching for water. Sometimes they even go and have to sleep overnight, digging river courses in order to get water. Children are not able to go to school, or even if they go to school, you see them dozing because they have to rise up early in the morning and go and fetch water.
We have a distribution system into about 5 schools in the community, and what we do is that we just mount polytanks at the various schools and then pump treated water to the schools.
As we have the water in the school, their enrollment has increased. Coming to the health of the children, we can see that they are no more complaining about sickness.
Previously, we used to walk a long distance to the Densu River to collect water, bring it home and use it for our household activities. The water is helping us a lot. With respect to my family, when they finish eating, I give them some of the water from the Water Health Center to drink as well. We no longer get waterborne diseases.
It has reduced diseases such as diarrhea, blue ulcer, typhoid fever, more enteric fever, and then kidney worm has been reduced, and even cholera. We've not recorded any cholera case ever since the water came to existence. So these days we don't have cases of school children coming here with diarrhea cases on and off because of the access to clean water. Those who don't have money to go and buy the water they've been selling, they now have access to clean water, which is for free.
For every facility, we recruit 3 to 5 people from the community who are trained, and they operate and man the facility. So in terms of businesses, for some of the communities, we have entrepreneurs coming to fetch the water and then also going to sell the water to others, which creates some small businesses.
I fetch water for people and send to their houses for them to use for their household activities. With the Water Health Center, I am able to go quickly, fetch water, and send to my clients because it is closer to me. I fetch more water for people. By that, I am making more money for myself.
That the water situation in Ghana is remarkably improving. We are actually getting nearer to safe water for all as per the MDG Section 7C. Government is putting in all efforts to ensure that we get to that mark.
The Safe Water for Africa's objective is to supplement or complement the work that our governments do to address the challenges they face in water, sanitation, hygiene, education.